Good afternoon, everyone. I'm Becky Wittes, Chairman of the Niagara County Legislature. Thank you for joining us for our daily COVID-19 update for Niagara County here on LCTV. We're also live streaming on lctv.net. We're on 90.9 FM on your radio, and you can find a link to the YouTube version on our county Facebook page as well. Today I'm joined again by County Manager Rick Updegrove, but first I want to give today's update as far as our numbers here in the county. We do have 9 new positive cases of COVID-19 to report today, giving us a total of 238 cases to date. We have 113 individuals in isolation. 84 of those are isolating at home, with another 29 who are in hospital isolation. The good news being that we have 116 individuals who have recovered from COVID-19 at this time. Again, we've announced so far that we have had 9 COVID-related deaths in Niagara County. We do not have any new cases to report today, which is the good news. But again, of course, our thoughts and our prayers and condolences go out to the families and friends of those individuals who have passed. That is never something that we want to have to tell you, and we're happy to not have any new cases today to report. The numbers have been updated on our COVID map on niagaracounty.com. At the top of the page is a COVID-19 banner. You can find a link to this heat map, which again breaks down our positive cases by municipality. And as you can see, same situation as we've had all along. Most of those cases are in the densely populated areas in the cities, with fewer out in the rural areas. Again, we continue to remind you, however, that those cases are everywhere. You need to act accordingly. Along those lines, we've said from the beginning we're not doing as many tests, of course, as we would like to be in the area. But according to the COVID-19 tracker, which is the state version of that map, we've had 1,030 individuals who have been tested in Niagara County. Again, if you'd like to look at that state map, we also have a link for that on our niagaracounty.com page, again at the top in the COVID-19 banner. And you can take a look at how the state breaks down some of our data county by county to give you an idea of what's going on here and around the state. Now, Governor Cuomo told us again today that hospitalizations, ICU admissions, and intubation numbers are all down again. This is definitely good news. It's what we've been wanting to hear, and we've seen those numbers trend in that direction for several days in a row now. But however, he did tell us again there were 606 deaths across the state yesterday. Now that number is lower than it has been, of course, over the last week or so, but still a very high number of individuals and sad news to hear. We hope to see the number of deaths continue to decrease daily, of course. We know and have said many times that that number of deaths lags behind the numbers as far as positive cases and hospitalizations, because it does take time when an individual has been on the ventilator long term and reaches the end of their battle. But it is good news that that number is starting to go down, and another indication that what we're doing with our efforts to distance ourselves is working. Reality check against that good news, of course, is that there were still another 2,000 positive cases reported statewide today by the governor. That number has been relatively flat and consistent. We're sensing, we're seeing that flattening of the curve, and our healthcare system has been able to maintain those numbers and handle them, which is wonderful. But it's still a significant number. We aren't seeing those decreases here yet in Niagara County. Again, we've said we are probably lagging slightly behind in the time frame that they're seeing in downstate New York. And we continue to do everything here that we can. So our message to you has not changed. Please continue to do what you're doing and keep yourself home and safe and healthy. We don't want the sacrifices that we've been making all of these weeks to be for nothing. So please continue to follow those guidelines as they are in place so that we don't see that curve shoot back up again here locally. We don't want to extend this any further, of course. To that end, Governor Cuomo did announce today that he is officially extending New York on pause until at least May 15th. Again, he tells us that is a date that he will reassess as we go, and we need to get closer to that date to see if he's ready to start putting things back, not to normal. That's going to be a slow process, but he is already thinking and looking toward that reopening process and how that might work piece by piece. But again, New York pause in effect until at least May 15th at this point. Part of the new mandate that the governor has put out is in regards to masks when individuals are in public settings where they cannot socially distance themselves from others. So tomorrow we're going to have Jonathan Schultz, our Director of Emergency Services, back on the show to talk to us a little bit about the different masks, the availability, and all of those questions that you probably have. But again, today I have our County Manager, Rick Updegrove, with us to talk about the mask mandate and how it's being implemented at the county level. Rick, first, can you talk about your understanding of the mandates regarding the masks and the two differences between the two mandates?
Sure, Becky. So 202.16 went into effect Wednesday night. And 202.16 deals directly with employers and employees that have direct contact with the public. And that one says, for all essential businesses or entities, any employees who are present in the workplace shall be provided and shall wear face coverings when in direct contact with customers or members of the public. Businesses must provide at their expense such face coverings for their employees. So that was the first executive order that dealt directly with face coverings. So we immediately set about implementing that, and we contacted our department heads, and they identified how many employees they have in each department who have direct contact with the public. And we secured cloth face coverings for each one of those employees. But then that was followed up, and this is the one that is going to take a little bit of thought. That was followed up with Executive Order 202.17, which will go into effect Friday night. And 202.17 says, effective 8 p.m., Friday, April 17th, any individual who is over age 2 and able to medically tolerate a face covering shall be required to cover their nose and mouth with a mask or cloth face covering when in a public place or unable to maintain or when not maintaining social distance. So that expands it from employees and the obligation the employer has to provide these to those members of our workforce that come in direct contact with the public. This expands it obviously to any person who's in public who's not maintaining social distance, which would apply to most of our employees, whether they're working in offices or outside working on a highway crew. I think this is, well, I don't think, obviously this is much broader. And so logistically, there are some issues, but we have implemented several things to address this. First and foremost, with respect to our county buildings and our employees. Our workforce has been reduced through the earlier mandate, 202.4, so we have less people in the offices. However, we are doing everything we can, and an exemplary job, by the way, of maintaining essential services. And I know we talked about some of our offices and the treasurer's office doing everything within their power to serve the public. We either have or are in the process of marking off social distancing guidelines with tape. It's as simple as that. We're going to put tape on the floor, and we're going to ask that people comply with maintaining a distance from the employees and from other persons who are utilizing county buildings. Third thing, we have put plexiglass on counters or at counters where our employees deal directly with the public in a couple of our departments. Those departments that don't have the plexiglass, I have been assured by Buildings and Grounds within the last hour that they will be in place for the open of business Monday morning. So social services and the clerk's office will have those plexiglass barriers that will limit any type of contact from customers or members of the public. And the fourth thing that we're going to do is we are going to put signage at all the doors, and the signage, we're still working on exactly what it's going to say, but I can tell you that the signage will reiterate 202.17. It will remind people that if they can't social distance, that they shall have face coverings in place. We may ask them, since it would be very difficult to guarantee social distancing when they enter our buildings, we may ask them to have face coverings in place. The only thing that I'm concerned about that we're still trying to work through is that we don't want to put our employees in a situation where they have to enforce this. That's just simply not fair. And we're going to do everything we can to take that burden and to minimize the possibility that that's going to happen. But this is a very broad mandate. It affects everybody. It affects the general public. It affects our employees, and I understand. I absolutely understand the intent of this executive order to limit exposure and to keep the numbers down. So we will continue to do everything we can to abide with these guidelines.
Thank you. And I see there's definitely there are two different executive orders regarding businesses versus your public appearances, but for us those things certainly overlap. And I want to thank you for working with our team very quickly. Oftentimes these executive orders come out and we don't have a lot of time to actually get the pieces in place and to make them happen. I imagine because of the two different executive orders, some of our employees have direct contact with the public, some are just working with their coworkers in the office. So I imagine you can envision situations where, say, a person might be working at their desk alone and have a face mask on, but then need to get up and put that mask on to then be able to walk through the office or to take care of a person who has come to the counter. So there will be times that people might see county employees from a distance who wouldn't be wearing a mask. And is that fair to say that would be the reasoning, because there's two different pieces in play?
That's one of the things we're working through. I think that will shake itself out department by department, because I believe that the employees themselves will not only understand the mandate and want to enforce the mandate, but I think that there'll be, I think that the employees themselves will remind others, if they are not able to social distance, that obviously they should be wearing face covering, but not only to protect themselves, but to protect other employees. With respect to dealing with the public, that's a lot more obvious. But when dealing with, and as you point out, it becomes a little bit more challenging when you're talking about how do you operate and enforce this within the office setting. But I don't think it'll be that difficult. I think our challenge is we were able to meet the mandate relative to our employees that deal with the public, and we provided them with cloth masks. Now it's been expanded, and we don't have, at this very moment, and that could change in the very near future, but we don't have enough cloth masks at this point for every employee. However, we do have some backup surgical masks that we do have if we need them. What we're asking our employees, and I know that this will happen because I've already talked to several this morning, to simply be reasonable and wear the face covering that they choose, because everybody, if you're going out to the grocery store or you're getting gas, you're going to need one. And most of the employees that I've talked to already have their own. And in fact, I talked to some employees earlier who didn't particularly care for the design of the one they were provided and decided that they were going to bring their own, which is fine. If you don't want to wear flowers, that's fine. If you have your Buffalo Bills face covering that you choose to wear, and I know that one of our employees offered me one, which I will gladly wear. People are able to do that. The executive order specifically says that as long as it's a cloth face covering, we've provided guidance on how to wear them, how to clean them, proper use. So every employee, every department has been provided with that information. And the reason that that's important is, although I believe that we will have enough in the very near future, as far as cloth masks go, we have enough disposable surgical masks, so there will be no interruption of business. That I can assure you of. But the reason that we want to make sure that we're monitoring the use of these masks is because we have an obligation to provide PPE to nursing homes, hospitals, and first responders. And that's a statutory obligation. So obviously, we want all of our employees protected. We're going to make sure that they are, but we also have this need for PPE on the first responder hospital side that we not only have an obligation to address and to comply with, but which we are obviously being very very diligent in making sure that they have this equipment. In fact, I spoke with Jonathan Schultz, our emergency management director, this morning, and he told me that to date we have provided the three entities that I just talked about, first responders, hospitals, and nursing homes, with 30,000 N95 masks, 95,000 surgical masks, and 10,000 face shields. And those have been provided through a combination of three things: the national stockpile, federal funding, and for those that aren't from the national stockpile or we did not receive direct federal funding for, we expect a FEMA reimbursement for those. So those are, that really it has to continue to be one of our priorities, to make sure the people on the front lines are getting what they need, if in fact they need them. And I think that the feedback I've been getting is that our emergency management has been doing a great job, given the circumstances, given the significant limitations of these types of masks and this PPE. They've done a great job of making sure that the people that need them have them. I appreciate their work on that front.
I know there's probably many business owners out there with the new mandate going into effect as far as supplying for your employees that are in contact with the public, or maybe just thinking ahead to the new mandate where they're going to want their employees to have them and help them get them anyway. I know there are a lot of businesses probably trying to figure out how to implement this as well. I know I've seen several posts on social media with instructions on how to make your own face masks, whether it's with bandanas, t-shirts, old material. They give you really very easy instructions to make those for yourself at home. So I would suggest that, if you're looking for a way to supply those for your business, that certainly that's an option. Also, many organizations in the community that are posting that they are making these, sewing at home and donating them to businesses that need them. Do you have any other advice for our local businesses as they're trying to implement these mandates?
Well, it could be as simple as going and doing a quick Google search, because I spoke with our emergency management director this morning, and he did confirm that there are several local businesses within Niagara County and within the town of Lockport that are producing these masks. So do a quick Google search. They'll come up. There's several businesses providing them. If for some reason, though, after you've done that, you still are having difficulty finding the masks, the county obviously, we will do everything we can to help secure those for you or help you find them. So if you are unsuccessful, feel free to contact us, emergency management, and we'll do everything we can to help you.
Great. And again, we'll have Jonathan on tomorrow to talk more about that as well in person. Rick, again, I just want to thank you and, of course, our entire team of department heads who acted so quickly together. We have these great calls every day where we really share ideas and work these things out. So thank you again for all of your work to make sure that these mandates were in place when they needed to be, that our county employees are prepared to be safe and to keep our public safe as well. So again, thank you.
All right, thank you.
Yesterday I mentioned that the county held its first virtual meeting of our standing committees for the legislature on Monday night via teleconference. We do now have those video recordings available for you. If you go to our Niagara County Facebook page or the county website under the Standing Committee tab, you can click on a link for all of those committee meetings that we held. You can see the resolutions that were discussed and watch the meeting as it occurred. So please check that out if you're interested. This coming Tuesday, the 21st, we will be holding our first full legislative meeting by teleconference, and we are putting the pieces in place for that currently, and we'll be able to announce to you very shortly exactly how that's going to happen and how you're going to be able to access that meeting Tuesday night to be able to watch and see the work that we're doing in Niagara County, even though you can't appear in public, to come out to those meetings live. We'll get that out for you. Our agenda will be up on the county webpage later today, so you'll be able to see all of that information. Also, yesterday we mentioned that our treasurer's office has now been able to put some safety measures in place and get their office open to the public from 8:30 to 4:30. But again, I would just like to reiterate that that office is, of course, following all of those safety guidelines that we heard our county manager talk about just a little bit ago, with lines in place so that people aren't standing too close together. Of course, the masks, we have very limited staff there. Again, I would ask that if you do believe that you have work that needs to be done with the county treasurer's office at this time, that you can reach out to them ahead on the phone, maybe see if you do need to come in person to handle that. But using those very minimal staffing guidelines and keeping everybody's safety in mind, they are there and available if there's something that you need to appear to work on with them. Again, we mention each day the Crisis Services Hotline for mental health in Niagara County. This one's very important. We know right now everyone is struggling. We want you to have the support that you need at this time, whether you're feeling anxious about the uncertainty of the situation and the financial stress that maybe it's causing on your family. All of those first responders and healthcare workers and essential workers that need to be out and working at this time, that can be very stressful as well. If you're having issues with substance use disorder or alcohol use, please don't hesitate to reach out for yourself or a friend or family member that's struggling. Again, that number is 285-3515. That's Niagara County Crisis Services. I've mentioned each day also that we each have to take our own personal responsibility in this situation. We need to stay home for our own safety to keep ourselves healthy and well, but we also need to think about those in our community who are more vulnerable. We've said time and again that if you're young and healthy, that does not mean that you can't, contract this virus. You might even have the virus and be carrying it and not know it because you're not seeing symptoms, or they're so mild that you're not even really noticing them. So again, we remind you to find that reason to stay home. If it's not for yourself, then make it be for a loved one or someone else you care about that you don't want to bring this virus home to. And for our healthcare workers who we don't want to overwhelm at this time with any more cases than we can handle. And I will tell you again that I stay home for our Niagara County first responders, for all those individuals who are out on the front lines each and every day, putting themselves even more risk right now with everything that they're facing. So please, again, keep that in mind as you're going about your day and really only going out for those essential services that you have to go out for. If you joined us late today, again, you can find us on demand after the show is done. It will be replayed on LCTV throughout the day as their schedule allows. We thank them again for this wonderful partnership and allowing us to get the information out to our residents. You can also find a link on their on-demand page at lctv.net under the Niagara County Legislature tab. We'll have the link available for you on our county Facebook page. And we also want to thank all of those other local media stations, the broadcasters, the newspapers who are using this information each day to update our residents as well. We thank you for joining us. Everyone, please, I tell you again, just stay home, stay safe, and stay healthy.